Anxiety. What is generalized anxiety disorder? Occasional anxiety is a normal part of life. Many people worry about things such as health, money, school, work, or family. But people with generalized anxiety disorder, GAD, feel extremely worried or nervous more frequently or more intensely about these and other things, even when the worry is out of proportion with the situation. GAD usually involves a persistent feeling of anxiety or dread that interferes with how you live your life. It is not the same as occasionally worrying about things or experiencing anxiety due to stressful life events. For people with GAD, these feelings of anxiety can last for months or even years. GAD develops gradually and usually starts in early adulthood, although it can occur at any age. Women are more likely than men to experience GAD, with some women experiencing it during pregnancy and the postpartum period. With the right treatment and support, people with GAD can manage their anxiety and improve their quality of life. What are the signs and symptoms of generalized anxiety disorder? People with GAD may worry excessively about everyday things, have trouble controlling their worries or feelings of nervousness, feel irritable or on edge frequently, feel restless or have trouble relaxing, have a hard time concentrating, have trouble falling asleep or staying asleep, or feel fatigued, experience pain such as headaches, muscle aches, stomach aches, or tension, tremble or twitch, sweat a lot, feel lightheaded, or feel out of breath, have a hard time swallowing, make frequent trips to the bathroom. Adults with GAD are often highly nervous about everyday circumstances such as job security or performance, health, finances, the health and well-being of their children or other family members, being late, completing household chores and other responsibilities. Children and teens with GAD may worry about many of the same things as adults, but their concerns often center on school, extracurricular activities, friendships, and the future. They may struggle with uncertainty, fear of making mistakes, or worry about disappointing others. Children and teens with GAD may strive for perfection as a way to manage their anxiety. For all people with GAD, symptoms may fluctuate over time and are often worse during times of stress. For example, during a physical illness, school exams, or a family or relationship conflict. Is it normal stress or an anxiety disorder? Life can be stressful. A person may feel stressed about a demanding job, a performance at school, or a life change. Everyone feels stress from time to time. Stress is the physical or mental response to an external cause, such as having a lot of homework or having an illness. A stressor may be a one-time or short-term occurrence, or it can happen repeatedly over a long time. Anxiety is the body's reaction to stress and can occur even if there is no current threat. While occasional stress and anxiety are normal, they shouldn't control your life. If anxiety doesn't go away and begins to interfere with your daily activities, you may have an anxiety disorder. Learn more about stress. What causes generalized anxiety disorder? GAD may run in families, but the exact cause of the disorder is unknown. Research suggests that GAD results from a mix of genetics, brain chemistry, biology, and environment. Researchers have found that external causes, such as experiencing a traumatic event or being in a stressful environment, may put a person at higher risk for developing GAD. How is generalized anxiety disorder diagnosed? To be diagnosed with GAD, a person must find it difficult to control worry on most days for at least 6 months. They must also have at least 3 of these symptoms: feeling restless or on edge, fatigue, trouble concentrating, irritability, muscle tension, or problems with sleep. If you think you're experiencing symptoms of GAD, talk to a healthcare provider such as a primary care doctor, psychiatrist, psychologist, or clinical social worker. During the visit, the provider may ask when your symptoms began, how long they have lasted, how often they occur, and their impact on your life. After discussing your history, the provider may conduct a physical exam to ensure that an unrelated physical problem is not causing your symptoms. What other illnesses can co-occur with generalized anxiety disorder? Some people with GAD have other mental and physical health disorders or conditions, including depression, other anxiety disorders, post-traumatic stress disorder, chronic pain syndromes, cardiovascular problems, or suicidal thoughts or behaviors. GAD is also commonly associated with alcohol and substance misuse. The presence of multiple disorders can make treatment more complex, and people with GAD and co-occurring mental disorders may benefit from a comprehensive treatment plan that addresses all aspects of their mental health.